Good morning and welcome to Face the Nation. Messy and confusing is how the Wall Street Journal's editorial board characterized the Biden administration's booster vaccine plan late last week. But they praised CDC Director Rochelle Walensky for the right outcome. This is a reference to her decision to include frontline workers with a high risk of exposure among those who are now eligible to receive Pfizer booster shots, along with adults with underlying conditions and those who are 65 and over. We go now to the CDC Director, Dr. Rochelle Walensky. She's in Newton, Massachusetts. Good morning to you.
Good morning, Margaret. Thanks for having me.
So can you explain what made you side with the FDA in saying people at high risk of exposure should be eligible to get this third dose when your own advisory committee did not come to the consensus? And exactly who is high risk?
Great. So first, let me start by saying that we still have 70 million Americans who are unvaccinated in this country, and these are people who are 10 times the risk of being hospitalized and 11 times more likely to die. So we have hard work in making sure we get those people vaccinated. But as I'm here to talk about boosters, let's get to protecting the people to optimize people who have already been vaccinated. So there is a scientific process. We have an FDA advisory board meeting. They then provide the regulatory authorization, and then it comes to a CDC advisory meeting, and then I provide those recommendations.
Right.
And there's been remarkable consensus in a lot of those discussions, people over the age of 65, people at high-risk conditions. And where there was some real scientific discussion and a scientific close call was for those people who are at high risk of living by virtue of where they live or where they work. And because of that close call and because of all the evidence we reviewed both at the FDA and at the CDC, I felt it was appropriate for those people to also be eligible for boosters. So who are those people? Those are people who live and work in high-risk settings. That includes people in homeless shelters, people in group homes, people in prisons, but also, importantly, are people who work with vulnerable communities. So our healthcare workers, our teachers, our grocery workers, our public transportation employees.
So teachers, does that mean other people living with unvaccinated children should also be considered high risk? Does that make parents living with unvaccinated kids high risk?
The recommendations were not intended for that population. It's really for people who are working all the time with many different people who might be unvaccinated, might be at high risk, and really the vulnerable community, the vulnerable occupations like our healthcare workers, our teachers, our public transportation.
So the category just seems very broad. So that's why I want to give some real world examples here. Should a healthy 20-year-old male who waits tables at a restaurant, for example, go out and get a vaccine, a third dose?
You know, this is really where we made it possible for people to be eligible, but they really have to identify their own individual risk and their own individual benefit. And I recognize that this is confusing, and we have a lot of resources available with your pharmacists, with your physicians, with your public health departments, and with the CDC. So really, I would try and get a sense from that individual, what kind of community, how much are people wearing masks? Are there masks in the restaurant? Are people generally vaccinated in that community, to make a personal decision about whether that person wants to be vaccinated.
So a 40-year-old parent living with unvaccinated kids, though, you said not necessarily necessary for them to get a booster.
No, not yet, and we will have more data forthcoming, and of course we will be looking at those data on an ongoing basis in real time and updating those guidances. But if that 40-year-old parent does not meet eligibility for some other reason, then I would say it's not time for that person to get vaccinated.
But, so you can understand that with boosted. Yes, I understood what you meant there. But you can understand when the president stands up there and says we're probably going to open this up anyway, and you're saying wait and see, there's some confusion. Are you going to recommend boosters for the general population?
You know, I recognize that confusion. Right now, our recommendation is for these limited people in the population over 65, high-risk workers, high-risk community occupations, as well as high-risk by comorbidities. We are evaluating this science in real time. We are meeting, every several weeks now to evaluate the science. The science may very well show that the rest of the population needs to be boosted, and we will provide those guidances as soon as we have the science to inform them.
So for those who didn't come to the consensus at the CDC, that the view that you did, what are the risks that they're looking at? What is the risk for that 20-year-old going out and getting a third dose?
Yeah, so that's a great question. So, as we've looked at the risks, benefit, and safety profiles of people who have gotten third doses, we have a lot of experience from other countries. Israel has vaccinated millions of people now with third doses, and we've actually vaccinated here up to 2.5 million people now with third doses. So we just don't have as long of a duration of safety for those third doses. But what I can tell you is so far in the 20,000 people we've looked at, the safety signals are exactly the same as what we've seen for the second dose. So, and we've vaccinated over 160 million people with mRNA vaccines in this country. We have an extraordinary amount of safety data. So, some scientists may say, wait, we want to wait and see what more safety data come in, whether there's a true benefit to be seen in trials and effectiveness. But there's extraordinary data to demonstrate the safety of these vaccines and, in fact, that they work. So if you're in a high-risk position, I would absolutely recommend you get the boost.
So when you are talking about the formulation of the vaccine, you're saying the second and the third dose are the same thing. Does that change as the virus continues to mutate? Should we all be prepared that we all will need to go get boosters every single year?
I want to emphasize that our goal right now is to stay ahead of the virus. We want to boost now so we don't end up in a vulnerable place. But your question is an important one, and it's one we don't necessarily have the answer for yet.
No.
We are working to stay ahead of the virus. We will see if we can get the amount of transmission down in this country and truly around the world, which we are also working to do, then we are anticipating and hoping that we will not have more mutations that will require more boosting in the future.
I appreciate at the outset you laid out the bureaucratic process that happens within the government to say yes or no on these vaccines. But we're in the middle of a national health crisis where trust has been diminished, where clarity and communication is so important. Was this the right way to actually get this done? I mean, almost every day we had a different message on whether to take the booster or not.
Yeah, I want to actually articulate that this is not the bureaucratic process. This is the scientific process. You have scientific experts, academicians who are talking about at the FDA advisory committee. The FDA puts its authorization. You have academicians, people who've working their entire career in immunology and vaccinology, informing the CDC. I think that this is an important scientific process and an important scientific dialogue. It has been scrutinized. It's been watched in ways that it has never been before. Mm-hmm. But this has been the process that has held us in good stead, and that I think is important for people who might, and is very transparent, and I think is important for people to understand and be able to watch the science so they have confidence in the process.
You said back in March you had a feeling of impending doom. You took a lot of flack for saying that in those terms, but
Indeed.
But we were on the cusp of the Delta surge. We are now back at 2,000 deaths a day. How do you feel now?
Look, you look at states around this country and you see places that are using crisis standards of care. That is not, and that means that we are talking about who is going to get a ventilator, who is going to get an ICU bed. Those are not easy discussions to have, and that is not a place we want our healthcare system to ever be.
Is that,
and we are working.
Is that what you meant when you said impending doom? What you're seeing now, crisis levels of care?
In some states, yes, they are running out of beds. And when you see that, you worry that people may not be able to come in and get the proper care if they have a motor vehicle accident or if they're having a heart attack. And that is why we are working so hard in areas that have high levels of disease, where they can't, their healthcare systems are in dire straits, that working to get assistance to them, working to get those communities vaccinated, because as I noted, people who are not vaccinated are 10 times more likely to be in the hospital. Our hospitals are filled with unvaccinated people.
Infections among children 5 to 11 are at the highest they've ever seen on a weekly basis, according to your agency's data. Are schools vectors of transmission? Is this where kids are getting sick?
Our science has actually demonstrated that the disease generally comes in from the community, and that when schools are practicing the proper mitigation and prevention strategies, it's not where the transmission is actually happening. So just this week we had 2 studies published. Over 96% of schools just in this school year have been able to remain open, and yet we also published a study out of Arizona that demonstrated that places that had no masks in place were 3.5 times more likely to have outbreaks than places that did have masks in place. So we know how to keep them safe, and when we don't use the proper mitigation strategies, they're more likely to have outbreaks and have to close.
Just very quickly before I let you go, should kids go trick-or-treating on Halloween? Is it safe?
Oh gosh, I certainly hope so. If you're able to be outdoors, absolutely limit crowds. I wouldn't necessarily go to a crowded Halloween party, but I think that we should be able to let our kids go trick-or-treating in small groups, and I hope that we can do that this year. Before I go, if you're not vaccinated, please get vaccinated. If you're eligible for a boost, go get your boost.
Dr. Walensky, thank you for your time this morning.